St. Joseph Kirkwood had become a small community hospital with a very tight-knit staff, nurses that were there for 20, 30, 40 years, and the patients would come back, and it was a very friendly place. The problem was it was a place to come if you were a little sick. It wasn't a place to come if you were really sick.
From the very beginning, the intent was always to keep Kirkwood connected. There was a long history, 50-plus years in Kirkwood, and cities like Kirkwood were very proud to have a hospital, and to find out they were losing it was not, a proud moment. But everyone in Kirkwood continued to support the move, and that was a lengthy process of looking how to build St. Clare so that it would not only maintain the fiber of what SSM was all about, but also provide an opportunity to bring something brand new. First brand new hospital to be built in St. Louis in over 30 years.
A lot of thought went into the design of St. Clare. And early on, even before I arrived on the scene, the group had spent a lot of time thinking about what that hospital needed to be in terms of its visionary requirements. What were going to be the guiding principles of St. Clare that would guide the design going forward?
It was groundbreaking to have a new facility that so much thought was put into the design for patient safety. Everything from the same-handedness to the rooms to the way things were laid out for safety. It was truly a remarkable experience to be a part of SSM as that was going on.
Putting the patient in the center of the design was very, very important. We tried to keep the nurses at the bedside as much as possible, put the medications in the room, minimize the amount of time the nurse had to leave the room to get medication, putting supply closets every 4 rooms, again, to minimize walking time, to try to keep that nurse at the bedside delivering patient care.
To be there in the beginning when that was designed and that it stayed true is what's phenomenal. We deliberately worked on changing the culture, the philosophy of the staff and the employees of St. Joe's Kirkwood to truly say, I own that. This is my hospital. These are our patients. I want to make a difference.
We're here to serve the schools, we're here to serve the churches, we're here to serve everybody who lives and works and plays in our community. Fenton and surrounding communities really takes an interest and takes a stake, if you will, within the success of SSM Health St. Clare Hospital.
The hospital is continuously supporting programs within the community, and then the outreach, trying to find out what the community needs and then responding to those needs with programs that fit. Anytime you can come into a community and do that and accomplish it successfully, it's a win.
So its impact on our community was great. When you think about the ability to impact healthcare decisions, to give the opportunity for people to have a convenient healthcare, because oftentimes convenience is a barrier for some of our families and our community members to get the healthcare they need. Poverty does play a role in some of the pockets of our community, and so having that reliable partner that really will work with our kids and our families to make sure they're getting the care they need is essential for quality education.
I think in many ways St. Clare is still somewhat of a hidden gem in the community. When I speak to community boards or chambers, etc., I talk a lot about the level of sophistication that we bring right here to the I-44 corridor with a level 1 stroke, level 1 STEMI, on and on and on, and we continue to expand those programs. So for a community of 4,000 or 5,000 to be able to have access to that kind of care right in your backyard is huge.
The clinical excellence that's performed here at St. Clare Hospital surpasses many around us. You think a small community hospital, but our quality metrics outperform the majority of the hospitals across the country. I think one thing that makes it different is that it's driven by the nurses, the staff at the bedside, those that do the work every day, make the decisions. They listen to the patients, they hear the patients. Not only that, we also have patients that are very satisfied. They're very happy when they come here. The comments, the rewards, the national recognition our nurses receive, it's phenomenal.
St. Clare to me is personal. It's unique. The culture at St. Clare is part St. Joe's. It is a friendly atmosphere that people do know your name.
I've often said that we can put systems in place, we can invest in technology, and we can have the best people in the world. But the foundation for all of that to click and work is the mission.
Every patient that comes to the door, they see those patients as their family members. Whenever they're talking about decisions, they're talking about if that was my mom or my dad or my son or my daughter. The foundation of what St. Clare was built on began with the perspective of patients. They looked at patients, they saw what patients wanted, they asked questions, and they built the entire hospital around the patient's perspective.
So as we look ahead to the next decade of St. Clare Hospital, I see really more of the same. More of the same exceptional care that we deliver, more growth, more high-end specialty services that we provide, and just keeping up with modern technology and needs of our patients as they evolve. I just see more of that serving the community, more of the partnerships with community agencies, and more of just revealing God's healing presence and delivering exceptional care.
Back when we moved, we said it's going to be a hospital like no other. And I think that's my goal, is to keep it like that.